The Ghana Health Service says despite continued education, demand for maternal and reproductive health services is on the decline. Authorities attribute the worrying trend to fear of those who need such services to contract COVID-19 during visits to the health facilities. The Ghana Health Service Adolescent Health Unit, however, says the measures are in place to guarantee safety of women and other patients. Ohiminteya has more in the following report.
Ashanti Regional Adolescent Health Coordinator Ebenezer Amankwa addressed a 2020 World Population Day event in Kumasi. He indicated anti- and postnatal services, labor and skilled deliveries have all dropped. Mr. Amankwa points out, though the trend has forced maternal deaths drastically down, the long-term implication can be dire. Earlier in March this year, the health service had raised similar concerns about lack of patronage of such services. Though figures are readily unavailable, JoyNews checks, however, revealed the situation has worsened, as Mr. Amankwa confirms.
Currently, just like in March, it's still like that because there is a fear of people who don't really have anything to do outside visiting the health facility. And it doesn't mean that people are still not getting pregnant. People are getting pregnant. So why are we not seeing them at the facility? It is something that we are looking at. It doesn't mean that children are not due for immunization. They are due. But why is it that they are not getting it? And that is the more reason why we came up with this guideline, so that it will guide us to work and provide the optimum level of care to the mother, to the baby, and to the adolescents. And so we are still working around it. Unfortunately for us, if you look at our indicators, we are not doing so well. Antenatal services compared to last year, the same period, it has dropped. Labor and delivery, skilled delivery services have dropped. Postnatal services have dropped. And because these ones are dropping, our maternal death has also dropped.
Health authorities are studying the development as Ghana Health Service outdoors guidelines for optimal maternal and reproductive care in the face of COVID-19. Special premium is placed on limited contact between patients and caregivers. Mr. Amankwa wants service seekers to take advantage of the arrangement.
During this COVID, we have seen that there is no issue in relation to contraceptive use. It means that mothers who are family planning clients or mothers who are practicing family planning services, they can still continue to provide the service, to get the service and use them. So we have a few guidelines that we've come up with. So if you look at the guidelines, if you look at the top there, we are looking at the service package, so antenatal. Then we look at special arrangements for all clients. And then the third one is the special arrangement for COVID-19 positive clients. So during antenatal services, we are saying that all clients should wear face mask at all times. Follow up by phone where feasible. We are doing that to minimize the physical contacts we are having, because it's important to protect our healthcare staff and protect the mother as well.
The 2020 Population Day was under the theme safeguarding the health and rights of women and girls around the world, especially during COVID-19 pandemic. Mercy Aduma Besia is the Ashanti Regional Director of the National Population Council.
It's just unfortunate that almost every attention is dwelt on the COVID-19, but we've relegated the issue of gender, the issue of women and girls or children, we've relegated that to the background, which is not auguring so well for our development. So this year, the UN decided that we should focus our attention on that, because a lot of women are being abused, especially during the lockdown period.
From Kumasi, for JoyNews, Ohiminteya reporting.